So my name is Raquel. Today I will demonstrate how to do the unoccupied bed making. So first and foremost, before you collect all your necessary materials, you have to wash your hands to prevent the spread of the microorganisms and infections. So we have your disposable gloves, we have your disinfectant, your wipes, and then we have your linens here. So you have to arrange all the linens according to its use. So we have your top sheet, your pillowcase, the pillow, cotton draw sheet, rubber draw sheet, and your bottom sheet, no? Okay, so before you start the procedure, and then we have your chair. Okay, so the chair should be placed on the foot part of the bed. So again, you have to arrange all linens according to its use. So before you start your procedure, you make sure that the room is well lighted, okay? And then you make sure also that the side rails are down, and then make sure also that the height of the bed is in a working level, in your waist level. And then you have to work on the one side of the bed first before you go to the other side, okay? Then you make sure also that you perform your proper body mechanics, for you to avoid straining your back, okay, or pain in your back, okay? So to start with is you have to go to the room of the patient, okay? So you have to start cleaning or disinfecting the bed. So you have to wear your gloves, make sure that your hands are clean. So wear your gloves. Then we're going to disinfect now the bed. So you have to start from the head part. You can use another wipes if you're going to repeat the procedure. Okay? Again, you have to perform your proper body mechanics whenever that you are doing the procedure of bed making. So you have to clean also the frame up to the foot part of the bed. So after performing the disinfection, you can now discard this one on the trash bin nearby, as well as your gloves. Then, discard it to the trash bin nearby. Don't forget to wash your hands again to prevent the spread of the microorganisms and infection. So now we're going to start in getting the materials here on your chair. So get first your bottom sheet. So the bottom sheet should be placed on the center of the bed, unfolded. So it has an allowance from the head part of the bed for about 16 to 18 inches, no? 16 to 18 inches, unfold. Medyo maliit yata itong 16 to 18 inches, allowance from the head part of the bed. And then you have to unfold it twice. Then you have to start tuck the head part. Tuck. Then you have to pull the hem, maliit. Pull the hem and do the mitered corner 45 degrees. Tuck. Then support the side and then tuck. Go to the foot part. Tuck. Wala na. Tuck. Pull the hem. Yung hem, yun yung tinako dito sa ilalim, no? Pull ninyo para maging fit dito. Yun yun. Then, do the mitered corner, 45 degrees. May triangular shape ako dito. Tuck nyo to. And then, half. Then, go to the head part. One hand will lift, one hand will tuck. One hand will lift, one hand will tuck. One hand will lift, one hand will tuck. Ayun, dalang-dalang ko. Then, get your rubber draw sheet. It should be placed on the center of the bed for about, it has an allowance from the head part of the bed for about 12 to 15 inches. Then, you have to pan fold it twice. No? Kung kaya pa. Then, if there's any hang side here, you just have to tuck it. Okay? One hand will lift, one hand will tuck. You have to start in tucking from head to foot part. Then, get your cotton draw sheet. So, the cotton draw sheet has an allowance from the rubber sheet for about 2 to 3 inches above. Then, unfold. Unfold it twice. So you have to reduce the wrinkles on your sheets. So one hand will lift, one hand will tuck if there's any hang side. Then get the pillow and place it to the foot part of the bed. Get your pillowcase. Then unfold your pillowcase. So you have to place your both hands inside of the pillowcase. Get your pillow. One hand will hold the pillow. One hand will pull the pillowcase. Again, do not jerk or shake your pillow to avoid the contamination. And then make sure that it will not touch into your uniform to avoid the contamination. You have to remember the opening of the pillowcase must be away from the door and window to avoid the contamination of your pillow. Okay? So you have to place it on the half side of the bed. Then we're going to go to the other side and we're going to grasp all the linens. So you have to perform your proper body mechanics again. So you have to tuck the head part, pull the hem, do the mitered corner, 45 degrees, tuck, then hem. Go to the foot part, tuck, pull the hem, and do the mitered corner. Then hem. And then tuck, and then hem. Then go to the head part. One hand will lift, one hand will tuck. One hand will lift, one hand will tuck. One hand will lift, one hand will tuck. Yung 45 degrees. No? Then get your rubber sheet. If there's any hang side like this, just tuck it. As well as your cotton draw sheet. Tuck from head to foot part. Then, move your pillow to the center of the bed. Go again to the other side. Get your top sheet. So instead in center, you have to place it on the foot part of the bed for about 3/4 part ng bed. Okay? 3/4 part of the bed. Unfold. Then, you make sure that your top sheet should be aligned on the edge of the mattress. Should be aligned on the edge of the mattress. Okay? Then, unfold it. You have to. And then, unfold it twice. Go to the other side. Just hang the foot part, no? Stretch your linen. Okay? Lipat ka dun pa. Ganito rin yung mga camera mo. Tapos na natin. So now we're going to make toe fleet. Okay? Toe fleet, the purpose of toe fleet is to, number 1, prevent the foot cramps. Pananakit ng paa, no? Pag hindi kasi gumagalaw, o pwedeng pag nagiging stagnant yung mobility nila, masakit yung muscle, no? Number 2, to avoid pressure ulcer in the sole of the feet of the client, especially kung bedridden po. Ibig sabihin nun, pwede rin pong magkaroon ng formation ng blood doon sa may sole ng feet nila. Kaya po tayo may toe fit. Number 3, to move freely the feet of the client inside of the top sheet. Okay? So, gagawin nyo lang po, you just have to use your thumb and your middle finger. Pinch. Then make an 8 inches allowance from the foot part of the bed. No? 8 inches allowance. Then, tuck. Tuck. So, yung gagawin nyo dito, mitred tayo. So, you're going to tap, di ba nakatap na siya? So, hilahin nyo lang po, you're going to pull the hem. Para fit siya dito, no? Pull your hem. And pag nag-mitred kayo, you just have to pull this one. Ayan, hanggang dito. Ito, kasama to, tsaka ito. No, tandaan nyo ha. Nakikita? Kasama to. Yan, ganito siya ha. Pag nag-ano kayo, mitred. Lagay sa kama, bitawan nyo na. Tap. Then hang. Okay? Then go to the other side. Same procedure. Bawal umupo pag nag-bed making. No? Bawal tumalungkot. You just have to pull your hem and do the mitred corner 45 degrees. Hang. And then, go back to the center of the bed. Then, just pull down your toe flit. Yan. Nakita mo yung mga side pa, tsaka yung side dito. Yan yung side niya. You have your 45 degrees. Nakita mo? You have your 45 degrees, you have your toe flit there. No? So, now we're going to show you the 3 types of an occupied bed. We have your welcome bed, also known as open bed. We have your surgical bed for post of client. Then we have also your closed bed. Okay? So first we have your open bed. So in open bed making, you just have to unfold your top sheet halfway up to the toe flit. And then, pan fold. You can use the back of your palm to reduce the wrinkles in your linen. Okay, so this is your open bed, is also known as what? Welcome bed, no? So this is indicated for client that is for newly admitted client. Okay? Para sa mga bagong pasyente. Okay? Bagong admit na mga client. Okay? For newly admitted client. Okay? Now I'm going to show you the surgical bed. So before we start unfolding your linen, you have to remove your pillow. Ma'am, why? Because your client came from the OR. So, to prevent the effect of anesthesia, such as nausea, vomiting, spinal pain, spinal headache, we have to remove the pillow. No? Again, nausea, vomiting, spinal pain, spinal headache. Para maiwasan lahat yon, you have to make sure na walang pillow. Pero yan po ay sa doctor's order then, and ilang oras? 6 to 8 hours po. It depends on the doctor's order. Okay? Then, you have to, dito ako kasi, dito ako nag-start. Usually on the left side of the bed kasi. Pwede mo din na sirain to, yung toe flit nyo, no? Pwede mo din na siya sirain. So, gagawa tayo ng triangular shape. Yan. So, this is a surgical bed. No? Meron pa tayong isa. Pag pinagawa sa inyo, yung tinatawag nila, sila ng cut kasi, ang gusto nila, eto, yan, tanggap nila ito, accepted ito. Kasi still, it is the surgical bed, no? Meron pang isa sa kanila, ganyan. Tinaas lang to. Surgical bed din sa kanila yan. Okay? Ma'am, bakit naka-half lang yung triangle? Kasi you're going to accept the patient from the stretcher Tapos, ilalagay nyo siya sa kama. Kaya nga lang, dapat nga ito, meron po tayong tinatawag na surgical bed na modified. No? Pag sinabing modified, mas maliit pa po yung kumot na nandito. Ibig sabihin, wala ito dito. Kasi di ba nakahiga yung pasyente, ilalagay ko dito, matatakpan yung kumot. Tama ba? Pag natakpan yung kumot, anong pwedeng mangyari? O taas niyo po yung, yung puwet niyo, alis ito po yung kumot. So, mag-i-istorbo yung pasyente. Tandaan niyo, meron pa silang effect ng kanilang anesthesia. So, baka hindi pa yan nakagalaw masyado. So, kailangan po, dapat pag nag-receive kayo ng client dito, wala na tong kumot dito. No? Kung may nakakita man po ba na pasyente o kaya naman yung mamunod sa room, bakit ganito yung bed? Matik po yun. Ibig sabihin, nasa OR yung pasyente. No? Ito naman po yung I love fold na nakalagay dyan sa inyong mga book. No? When you say I love fold, you have to untuck the half of your bed. Of your top sheet. No? So, ito lang po yun. Untuck nyo yung half, lagay nyo po dito. Huwag nyo natatak to. Pag hinak nyo to, hihilahin din niya mamay, magugulo yung ibang dinin nyo. No? So, ganito lang po yan. This is the I love fold. No? Ito yung modified. Diba? No? Mas okay siya. Kasi pag bumigay yung pasyente, kukumutan na lang ako. Hindi na kailangan mag-excuse sa akin. Nakatanggalin niya yung kumot sa ilalim ko. Okay? Pwede rin may makikita kayong mga nagsi-surgical bed, pero ang ginagawa po nila, nag-i-start na sila sa open bed. Yung kaninang ginawa ko, yung una natin ginawa, yun, nag-isimula sila doon. Sa kanila ngayon sa surgical bed. Okay lang din po yun, no? Lahat naman din daw po ay accepted naman po with our assessor, no? Lahat naman po yun na pinakita ko kanina. Pero dito, lahat po pinapakita ninyo, lahat ito gagawin ninyo sa assessment. Okay? Then we have your closed bed. So before tayo mag-close, syempre, you have to bring back the pillow. Ibig sabihin ng closed bed, it is indicated for discharge client or after cleaning the room. So sa nag-start mag-tap, laging sa head part. One hand will lift, one hand will tap. One hand will lift, one hand will tap. So literally, nakatap po lahat yung closed bed. And after, so again, this is indicated for discharge client and after cleaning the room. No? So after the procedure, you have to make sure that all the used material should be placed again to the proper place, and then you have to document, report it to the nursing supervisor that you're done, and then wash your hands again to prevent the spread of the microorganisms and infection. That's it. Now,